When my son Lucas was fitted for a helmet last year to fix his flat spots, I was hurt and frustrated. I couldn't believe what I was going to do to my baby. I quickly learned, had I changed his head position each time I put him to sleep, this situation could have easily been avoided. That's when I realized the need for a device to help remind parents to turn your baby.
My name is Dr. Chad Perlin, and I'm a pediatric plastic surgeon in Miami. I first met Irene when I took care of her son Lucas, who had positional plagiocephaly, or flat spots on the back of his head. Along with Lucas, we see hundreds of children each year in our office alone with this same problem. As a physician, one of the things that concerns me is that we spend so much time treating this problem, but so little time working to prevent it. That's why when Irene came to me with an idea for a device that was designed specifically to remind parents about this important prevention technique, to turn your baby, I got excited. This is something that is long overdue.
I remember thinking, even if I had known to turn my baby, I probably would have forgotten. Because it's not just about remembering to turn your baby. It's also about remembering what position he slept in last time. So the idea behind Turn Your Baby is to put a simple reminder where it counts most, right where you put your baby to sleep. This lets you track which side of his head he slept on last time, so you can choose a different position each time. As you can see, the device has 3 buttons: left, right, and center. When you put your baby down to sleep, you press the button corresponding to the head position you choose, and it lights up. It's that simple. Then, the next time you put the baby down, you can't help but notice the button that's lit up. Now you can easily remember to choose a different head position each time.
The American Academy of Pediatrics recommends that parents put their babies to sleep on their backs to prevent sudden infant death syndrome. Studies have now shown, though, that up to 50% of babies are developing flat spots on the back of their heads. We do a great job with the Back to Sleep campaign, and we often do mention to turn your baby. But we now know that we need to emphasize this important prevention technique. The beauty of the Turn Your Baby device is that it reminds parents to do this, and it solves the problems I've seen with other attempted solutions for flat spots. The reason I got involved is because I see a real opportunity to shine more light on prevention techniques for positional plagiocephaly. Irene's commitment to helping other families is inspiring, and I believe in her, and I believe in the device. The time for Turn Your Baby, both the device and the campaign, is now.
Please help us make Turn Your Baby the new normal for parents with newborns by supporting our advocacy campaign and pre-ordering one of our convenient reminder devices for yourself or someone you know. Please help us to put this problem to sleep and remind parents to turn your baby.